There are 1.3 million attendances at Scotland's 30 emergency departments each year. To help inform planning on how best to allocate NHS resources, we've looked at the times of day patients arrive. We've identified some interesting patterns. On weekdays, the number of patients arriving continues to fall from midnight to a low between 5 and 6 a.m. From 7, the number of patients arriving starts to rise sharply up to a peak between 11 a.m. and midday. We've identified that this peak is mainly attributable to older patients. After this initial peak, the number of patients arriving drops slightly as we move into the afternoon, but starts to rise again in late afternoon and early evening until we see another peak in patients attending between 6 and 7. We've identified that this peak is mainly attributable to children and young adults. The number of patients arriving after this secondary early evening peak then continues to fall in the approach to midnight. On weekend days, we see a similar decline in the number of patients arriving from midnight to a low between 5 and 6 a.m. We also see the figure sharply picking up again from 7 a.m. The number of patients arriving reaches a peak at weekends slightly later than during the week, between 1 and 2 p.m. Another interesting characteristic of this trend is that there is only one peak at the weekend. After this peak, the number of patients arriving declines towards midnight, but at a slower rate than during the week. Analyzing the pattern of patients arriving allows service planners to anticipate the demand. By identifying the different patterns of different age groups, we are able to gain insight into the different types of services that will be most in demand throughout the days and weeks.